welcome back to Ask Dr. Angela, and today we're going to answer a very common question that I've been getting. Is my penis actually hard enough? So over the course of the last few months, I have plenty of write-ins, and as I probe further, then I start to see that people may not have a good concept of what exactly is a hard penis and what exactly is a soft penis. So I'd like to share with you a grading system that you can assess this for yourself. So this grading system comes in 4 different grades. First, grade 1, where your penis kind of feel like a marshmallow. It gets a little bit enlarged during stimulation, but not quite hard enough. Okay, and grade 2 feels like a peeled banana, where there is actually enlargement of the penis and they're somewhat hard, but just not hard enough for penetration. And grade 3, we talk about it as like a unpeeled banana, where it is hard and is okay enough for penetration but not fully rigid. And grade 4 refers to like a cucumber, where it's absolutely rigid and hard enough. But when it comes to the context of lovemaking, rigidity of the penis is just one thing and penetration is another thing. Because penetration is essentially required if you want to make babies, right? Because the females and the males can get stimulated in various ways without penetration, which we'll talk about it in another episode. But today I'd like to bring the focus on, let's say if you find that your penis is not quite hard enough for penetration, what should we do? Okay, so let's say, if you happen to have a penis that's not hard enough for penetration, what can we actually do about it? First, we have to distinguish, why is that so? Is it mainly due to psychological, or is it a medical reason? And there was, someone that I used to work with. So his case was a very typical case of a psychological related erectile dysfunction. So whenever he's tried to be intimate with his partner, he just couldn't get it up. He was all so anxious, so uptight. And the more he thinks about, I can't get it up, it doesn't get up. So this is a very obvious case of psychological dysfunction, and once we sort out his stress and his anxiety issues, he didn't have a problem. And of course, at the start, to help him build his confidence, we gave him a little bit of, Cialis. If you heard of Viagra, Viagra is just one thing, Cialis is another one, where we it's a longer term drug. Anyway, that besides the point. So when we actually pair up drugs together with psychological treatment, we see a very good enhanced effect. And now he's off the medication and having a great time in the bedroom. So then how do we tell that your case is kind of like more medical related or more psychological related? So for more psychological related cases, it's quite obvious in the sense that most of the time, you still are able to masturbate, you still have your morning erections, and things seem to be going on fine if there is no intercourse, or perhaps if you have a different partner, it still works. So I remember once my lecturer used to tell me, the best solution for any form of sexual dysfunction, change the new partner, and you will know whether it's real or not. Okay, well that's the point. So if you do realize that you're still functioning normally outside the bedroom, I guess you're pretty fine. It's more psychologically related. But if you notice that your erectile dysfunction count is progressive and you're of a more senior age group like 40 and above, this might be due to your lifestyle habits. So smoking, diabetes, heart diseases, etc. are known to cause erectile dysfunction, and this requires medical treatment for your erectile dysfunction as well as your unhealthy lifestyle habits to be changed. So that's all I have about erectile dysfunction today, and see you again soon! If you enjoy our content, remember to hit the like button, subscribe to our YouTube channel, and make sure to turn on the notification button so that you don't miss out on any tips and tools to make your sex life better. Thanks for watching, and I'll see you in the next video. Bye bye!